Hello, I'm Raggy Omar. Welcome to another edition of Witness. Doctors around the world are trained and guided in their work by a code known as the Hippocratic Oath. It's an undertaking in which doctors commit to treat the sick and injured without prejudice or favour, according to their need. It's a noble aspiration, but doctors are only human, and like the rest of us, they experience the same political, racial and religious views and prejudices. Peter Tetru's film introduces us to a team of Israeli surgeons who have to confront these moral dilemmas every day. I'll be discussing these issues with one of the surgeons later in the programme. He and the team treat children from around the world, including Palestinians who have congenital heart conditions. But the extremely delicate surgery is easy compared to the ethical minefield they have to negotiate. While some have called it treating the enemy, others accuse them of playing God. The surgeons see it as simply caring for their patients.
It is fulfilling yet hard. I think this project gave a different meaning to my life. A doctor plays God a little bit, to a certain degree, but in this type of job, we play God more than a little bit.
With violence endemic outside, some Israeli doctors and nurses are trying to do their bit for peace. The movement is called Save a Child's Heart, a voluntary project for children with heart disease.
Especially in days when we operate on the kids.
Complicated life-saving operations are being performed here on children who are sometimes only a couple of months old. The children come from countries that don't have the facilities for such complicated procedures. Whilst the doctors are Israeli, a third of the children are Palestinian. Dr. Akiva Tamir, formerly retired, should be playing with his grandchildren by now, but he can't stop. During his work, he's focused and introspective. Looking back, he thinks of the children he's treated.
During the last 3 years, we had like many events of suicide bombers. A lot of people died on the street. And when you go back home, you open your TV, you see that. I used to go home and cry like a child. I was going absolutely mad. But this is one part of the problem. The other part of the problem, you have families with children. If you're not going to treat them, they're going to die. And those children are not to blame, you know, they've done nothing. On the other side, we live in this place, in this situation.
There's little communication. Dr. Sion Houri is responsible for keeping the project running. He says he has never got used to treating Palestinian children in Israel.
Some of them have a disease which is very severe, and sometimes we have to decide that we will not take them because the likelihood of succeeding is so low, but in another place they may have succeeded. So that brings a lot of moral issues, and my mind is occupied a lot with these thoughts.
Dr. Nashash, you're welcome to invite him on your own if you want to. We'll be glad. You can, you know, I'd be glad to. It happened to us that a child was treated by us, and we actually saved his life because he was about to die. And he went home. He was coming back here to be seen by Dr. Tamir once every year. And a year ago, we heard that he was actually shot by the soldiers.
Il n'ira pas beaucoup plus loin. La nuit viendra bientôt.
Here we take it as a very heavy responsibility because we know that our decisions actually send people to death or to live, and it's a heavy burden.
A typical day in the intensive care unit. Dr. Tamir is examining a 6-year-old girl. The heart disorder is life-threatening.
the blood comes from the left atrium through a valve into the left ventricle, and it will go out from the left ventricle into the major artery, the aorta. And actually here there is some abnormal tissue that obstructs the outflow. Also the valve is deformed, it's a little narrow. This creates a lot of burden on the left ventricle that has to pump the blood forcefully out because it has obstruction.
The late Dr. Ami Cohen started this project almost 10 years ago. His vision was to save the lives of young patients with heart failure from poor countries by giving them free treatment. He wanted to go to countries like China, Moldavia and Ethiopia. Akiva Tamar was the first doctor to join him.
I remember at our very beginning when we were in Moldova, and a mother came to us with a baby that was very, very blue, and the surgery that he needed was complex, and we were not doing that kind of complex stuff at the beginning. And I was kind of shrinking inside because we decided not to take very severe cases. Eventually, Ami Cohen and myself, we kind of melted down and we said if it was an Israeli child, we would take him anyway. So we took this child and he was doing very well afterwards. He had 2 surgeries and he had a really complete repair eventually.
There are many situations, especially when we are abroad, when we screen patients, we're facing sometimes 200 patients waiting for us, and we need to screen them all in 4 days. And every patient has few minutes with us, probably the only doctors that he will see ever in his life. And in these 10 minutes, we need to decide what is going to be his fate. Is he suitable for operation or not, or when? And in these 10 minutes, you put all your knowledge, everything that you get, and you need to make the right decision. You make the wrong decision, you just sentence a kid's fate.
Children from all over the world came to Israel to be treated. Then the doctors realized that, closer to home, there was another group that fulfilled the requirements of the project: Palestinian heart patients. On Palestinian land, the medical standards were equally poor, and there was no money for this kind of life-saving procedure. Now, a third of patients are Palestinian, and thus more than 350 Palestinian children have been saved from certain death. There's little communication with the parents. Often they can't travel with their child, or don't dare to. There is only a handful of mothers in the hospital. The doctors leave them be and focus on the often impossible choices.
Okay, we're coming here.
The doctors are helped by 2 American volunteers, Philip and Brian. They pick up the children and bring them home after the operation. They form the connection between the 2 parties. Time and time again, they pass the front line with mortally ill children. They're convinced their work improves the chance of peace.
So we're going to be waiting here for a little while the parents wait on the other side of Erez crossing.
You wonder, are what we're doing making any difference? And I guess speaking personally, I think it does. You know, even if you're touching just one mother that comes here and spends a month in the hospital, she sees that the Israelis aren't the terrible enemy or the Satan that they hear on that side, and the doctors see very tender Palestinian women who love their children. Every week, in a sense, we feel like we're just a little drop in an ocean of hate. We're trying to provide a little bit of sanity and kind of a mad, mad world here.
In this bed lies Sajid, 2 months old. He was brought in from Gaza in a critical condition. It appears to be hopeless. Dr. Tamir is facing an impossible dilemma, because treating Sajid will exclude treatment of other children.
I evaluated the child, and I saw that he has a very, very complex heart lesion with 1 chamber on the right side, 1 AV valve instead of 2, severe narrowing to the lungs, abnormal return of the pulmonary veins. And with all that combination, my calculated risk is that he will not make it to a final surgery.
Tamir presents the case to his medical team. 3 doctors are for an operation, 3 are against it. An impossible moral dilemma, because giving Sajid an operation will mean turning another child down. There is another dilemma for the doctors: Sajid's nationality. However, nationality cannot and should not be taken into consideration. As a professional, you have to put your sympathy or antipathy aside, says Tamir, but he doesn't sound convinced.
I cannot believe that you will never, this will never cross your mind.
No, I mean, sometimes it does. I do think of things like that. Like, for instance, there was a child here that got injured when he was throwing stones on soldiers. It became his heart problem. Well, I thought he was a teenager. Well, of course I thought that he was involved in some bad actions against us and got hit, you know, like, it's not that I'm ignoring everything, that I'm kind of a superhuman being.
The next day, the decision has been made to operate on Sajid anyway. Dr. Sanun performs the procedure.
You need to take everything into account, but when you are facing a kid that you know that he will die if you won't do anything, you cannot overlook. And we felt that we need to give this kid a chance.
Directly after the operation, complications arise. But the doctors cannot help Sajid anymore. We can only wait. The child is kept alive by a machine. It's now 10 p.m.
I don't think the chances are too good at this moment.
Mm-hmm. Do the parents know the condition?
Yes, yes. They just came here with a kid almost dying, and we had to resuscitate him. So they know that the situation is serious, and they know that we are doing our best to save him.